This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, what's troubling you today, John?
I have this really weird-looking rash thing on my chest. It's kind of below my collarbone, and it's become really itchy over the last day. It's really bad at the moment, actually, and I can't stop scratching it. I mean, I'm trying, but it's too hard, and it looks all kind of scaly and pink. It's pretty weird. And then yesterday morning, after my shower, I noticed there's a lot more of these little spots coming up around it. There'd only been a few up until then. It's definitely getting worse, look.
Okay. Well, that looks like what we call pityriasis rosea. A fancy name for a rash, really. It's common for your age group. Have you been ill at all recently?
I had a bit of a cold for a few days last week. Just a runny nose, sneezing, that kind of thing. I'm fine now, though. About 3 weeks back, I had a really bad nosebleed, and my mum took me to emergency, and it ended up being nothing.
Having a cold right prior to an outbreak is quite common too. The rash usually clears up by itself after a couple of months and rarely reappears, but you'll need to avoid excessive sun and regularly apply generous amounts of moisturiser.
But I have a beach party this weekend at my mate's holiday house. If I can't be out in the sun, then there's no point going. I mean, it's actually his 18th, and he's my best mate. Also, this looks pretty disgusting, and there'll be lots of people there. Isn't there something I can take to help clear it up, or at least stop it from spreading more? Because if that happens, by the weekend, it could cover my whole body.
Oh, that won't happen, I can assure you. But you will have to keep your shirt on for the hottest part of the day. Do you have any allergies, John?
Yeah, I've been allergic to dust mites since I was about 13, I think, so my mum's always cleaning. My skin usually just gets really itchy, and I sneeze like mad. When I was really young, I was allergic to milk, but I'm over that now. The only other thing I have to keep away from is that stuff they put in cheap takeaway food to make it taste nicer. Oh, what's it called? MSG, that's it. That stuff gives me shocking headaches, makes me so tired that I can't do anything for about a day.
How about medical history? Have you ever had any major illnesses or operations?
I had chickenpox when I was a toddler, but I've also had to go to hospital 4 times for things. I've been a skateboarder since I was 6, so I've had a few spills. I broke my left wrist when I was about 8 years old, skating off a quarter pipe. That was a pretty bad one, but I made it over 5 of my friends who were all lined up on the ground. Then later, I'm not sure how old I was, maybe 11, I had one of those really small breaks, like a hairline fracture in my elbow. I also broke 2 of my fingers on my right hand. I had to have them strapped up. That was a pain. And then my last one was last year and was probably the worst because it was so painful. It made the other ones seem like a joke. I had to go into emergency because of some pretty serious grazing along my leg. I came off my board going down a hill on the side of this really rough road. It had dirt all in the wound.
Ooh.
They just washed it out and put bandages all up my leg, but I was in agony.
Well, hopefully that'll be the last of your injuries, so...
For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
OK. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hands into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there. My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, the tears are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common, even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them, but maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
OK. Well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Not at the moment. I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least. Now, before I give you any other...
That is the end of Part A.